as we're wrapping all this up in this last segment here, would love to know. So you are in complete response. You got a complete, which is awesome, which is wonderful. What is sort of the follow up? I know you have maintenance therapy coming up. If you could just give us a description of that.
Maintenance therapy for me requires 2 cycles of the Revlimid, which is 8 weeks of a weekly shot. And then I'll do the Revlimid at 15 milligrams. Then starting in October, they'll reduce the Revlimid milligrams. So I'm not sure where they'll reduce that to, whether it'll be 10 or 5. And then we'll go to only having the Velcade shot once a month is what the plan is for that. And then I will do the Revlimid and the Velcade for until I get a break, and then I'll get a break, and then we'll start up again. Since there's no cure for multiple myeloma, you're usually on maintenance for the rest of your life. So,
right. No, and I want to talk about that aspect of it for sure. You did mention 2 cycles of Revlimid. I think you meant Velcade in the beginning, right? So 2 cycles.
oh yes, two
Velcade. Yeah,
cycle. Yeah.
perfect. And then hopefully the Revlimid will be, which is a daily dose, will be reduced from the 15 milligrams to hopefully 5 or 10 in October or so, right?
Yes, that's correct.
But I want to talk about this. This sort of your ongoing maintenance therapy. That's just part of the expectation with a multiple myeloma. How do you approach this? And have you had to process this? The fact that you'll be on some sort of therapy or treatment ongoing indefinitely.
Mhm. Yeah, that is something I have been processing. And I don't think I'm completely through processing what that's going to look like, because everything is still so brand new. I don't have the years under my belt. I only have just the last few months under my belt. But I do kind of look at it being more like just a chronic illness, whether it'd be like diabetes, or if it would be like someone who had heart disease and they had to be on certain heart medications. For me, that's how I am viewing that and coping with that, knowing that it's going to be a lifelong thing. And then also, that just doesn't mean it just doesn't mean it's the end either. It doesn't mean that I'm only going to have 5 or 10 years left. I mean, there's people that have had a longevity of life. And because I told you that we were strong in faith, I still strongly believe that God, when He's done with what I'm supposed to do here on earth, then that's when I'll go on home. But I'm not looking at it as a death sentence, so to speak. I don't want it to be a death sentence. I want it to be where I can encourage people while I'm here, and we can walk through it together. And I don't have to be alone, and you don't have to be alone with this diagnosis. And we'll just take it one day at a time.
Again, beautifully said. Thank you so much. I think your story, the fact that you're even sharing it here, it's going to reach so many people who I think are yearning to just hear someone, else going through all this in depth, in a very human way, right? And I appreciate that you've just been so vulnerable in this conversation. So, on that note, the sort of, I guess, good news in that is, yeah, there are so many people who live with myeloma for many, 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 many years. And in fact, the landscape of treatments for multiple myeloma, especially for if things don't work, the standard 3 drugs or whatever, don't work. They've got all these different clinical trials going on that I'm sure you've been hearing about. So I guess, do you have any message about that? Just sort of the importance of continuing try and find the next thing. And I know there's CAR T, and then there's, different sorts of combinations that people are trying.
Yeah, I think again, go back to that communication and that relationship with your doctor, and to keep going, and to keep believing that there is going to be a cure. And that I think probably the biggest message is never give up. Just never give up. And just keep at it. And your body will know when enough is enough. And but just never give up. Keep going at it and putting one foot in front of the other and taking it one day at a time. And draw strength from others. And for me, I draw strength from God. I think I just want people to know that they're just not alone in whatever they're going through, whether it's cancer or whether they're struggling with things with their family. Um, it doesn't have to just be cancer. Um, you don't have to be alone in what you're going through. Um, you don't have to feel like you're on an island, and you can have a strong support system, and you can reach out to people. And if you're too afraid to reach out to people, then um, hopefully people will reach out to you. But I think never giving up and then just having that support system have been, I think that's where both where my emotions are coming from, is just having both of those things, that they have meant the world to me in my journey, is knowing that people were out there caring for us and loving on us and being the kind of human that I want to be.
I can tell that that love and that support just means so much to you, and you're trying to give it back in spades, which I am so appreciative of. On that note, what has been the biggest help for you? I know that for instance, people just showing up to shave their head, sending you those messages, that has been incredible. Have there been real sort of day-to-day things that have helped you? I know you said you don't have, young children
Mhm.
anymore, so that's good because, you don't have to focus on that while you're focusing on yourself. But what kind of support was most helpful? Because I think people like to offer it, but being specific, I think, matters.
Um, I still am getting cards from people in the mail, and sometimes there's some financial support in those cards. I had my husband's place of work did a fundraiser for us. That was a blessing. I had another friend that did a GoFundMe, and that was a blessing. And then I had um, the weekend after I got out of the hospital, and this is probably the thing that has probably meant the most to me, was because of COVID. You can't get a whole bunch of people together. And my husband organized a parade for me. And um, so I sat in the garage out in our driveway and wrapped up in a heating blanket, so I'd stay warm because it's in December at this time. Or yeah, at this time it's December. And there were people that just came out of nowhere. I didn't even realize we had that many friends. But there were like 100 cars in this parade. The police had closed off. Honestly, they closed off our block, and there was just people that just came out of nowhere. People I hadn't seen for years that sacrificed their Saturday just to drop off a card and just say, "Hey, I'm thinking of you and I'm praying for you." And it was probably the most memorable thing out of all that we've done, um, that has happened in the last few months. That's probably been the thing that has stood out the most.
Fantastic that you got to see a real show of support,
Mhm.
that's especially during COVID. So,
Yes.
I'm so happy that you got that. Just two quick questions from me. One is you touched on this, which was the going back to work, and there's the GoFundMe. I mean, because we call it the terminology would be financial toxicity.
Mhm.
I don't know if you've heard it, but it's just you get diagnosed with cancer, but then it's not just dealing with the disease and fighting for your life or for your quality of life, but how am I going to pay for it?
Mhm.
Or if you're not working, all the sort of domino effects of that. And I know you had some leave, so that's wonderful. Do you have any lessons that you've learned so far? Any tips for other people on how to, get some resources or navigate that? I mean, it could be as simple as, yes, put on a GoFundMe, have someone do that for you. Don't worry about anything else other than getting that support.
Mhm. Yeah, if you have a friend that will do that, there are also scholarships that you can get from your wherever you do treatment at your cancer facility. They have someone that you can reach out to in the finance in their finance department, and they'll help find you scholarships. We've had some scholarships that have come through. There's also scholarships available even to pay for your medications, um, and even to pay for any type of chemos that you have. And most of your cancer clinics will be able to help you with that, and you'll be able to do that. And you can even connect with your city if you have issues with power bills. There's just a lot of scholarships out there that people donate so that the cancer patient cannot don't they don't have to stress about the finances.
It helps to preserve your bandwidth. I appreciate those suggestions. Those are very real tips. And by the way, for anyone watching this too, social workers, there are plenty of those in hospitals who really are dedicated to helping you figure this out. So, just ask, I think.
Yeah.
My last question to you, Marty, is just, you're sharing your story, you're sharing it vulnerably. I hope it's been good for you to do it. But what's the importance? Two points to this. What's the importance of people sharing their patient story, if you will, and the importance of people listening, whether it's other patients and caregivers or even doctors or people doing research in pharma. It's this voice that we hear about, but I don't know if people really understand how important it really is.
I think it's important for you to share your story because um, it helps with healing. It helps not only give it a voice, but to say, hey, yeah, I went through that. But for me, it's also, I went through that and I overcame that. So that's why it's really important. And then also to um, share my faith with people too. I think that for me, that's really important is to share my faith and that it's important for others to hear it. The reason why it's important for you to hear it is because I have watched some people go through another, maybe not cancer, but maybe another illness, and I didn't understand. Um, but in as I've walked the journey and not only experienced it, but I'm hearing other people's story, it shows me where I can help. Maybe I need to be that person to drop a card in the mail to someone and give them, maybe a gift card of food like people have done for me or for a restaurant or something like that. I think it's important for you to hear so that you know where you can help and where you can meet a need, because there's plenty of needs out there, especially when it comes to cancer patients, but also being sensitive to the other people that have maybe a chronic illness.
Yeah, it's not contagious to cancer. It's everyone who's dealing with something, right?
Exactly. That's right.
Well, thank you so much, Marty. I really appreciate you spending all this time with us. Again, being so vulnerable and open with your story. And we will keep, people posted on how it goes with you. And if you ever want to, say hi, on the platform again. We're so happy to have your voice again.
That sounds great. Thank you for having me, Stephanie.
Absolutely. And for everyone, of course, interested in reading Marty's whole story or watching the entire conversation, just head to thepatientstory.com where we give human answers to your cancer questions.